Bore da I bob un ohonoch chi a unwaith yn rhagor croeso cynnes iawn I gyfarfod y bwrdd iechyd yma ym Mhawys. Fel dyn ni gyd yn gallu gweld, fel dyn ni gyd yn gwybod, fe gynhelir y cyfarfod heddiw yn rhithiol, ac yn ôl ein harfer, ar ôl y cyfarfod, mi fydd na recordiad o'r digwyddiad ar gael ar wefan y bwrdd iechyd, ac fydd hynny ar gael I bawb yn dilyn y cyfarfod heddiw. It's really good to see everyone. A very warm welcome to each and everyone in the meeting and accessing the meeting this morning. As always, we're meeting online, and there will be a recording of our meeting available on our website for anyone to watch and to catch up with online after today's meeting and today's discussions. I'm Carl Cooper. I'm chair of the Health Board, and as our meeting progresses, you will see details on the screen of other participants and other members of the Health Board as they contribute to our discussions. Bwrdd undebol ydyn ni, a beth mae hynny'n golygu ydy bod ein haelodau ni yn gymysg o aelodau gweithredol ac aelodau undebol. As a unitary board, we bring together within our membership executive members and independent members, and in doing so, we bring together that professional executive expertise and that informed independent scrutiny so that as a board we can make the best decisions possible for the people that we are here to serve. And our purpose as a board is to be the governing body of the Health Board. So felly, ein cyfrifoldeb ni, ein rôl ni fel bwrdd ydy gosod strategaeth i'r sefydliad. Ein cyfrifoldeb hefyd ydy gosod archwaith risg o ran sefydlu a chyflawni ein hamcanion strategol, ac hefyd monitro sut dyn ni yn cyflawni yr amcanion hynny ac monitro a chraffu ar ein perfformiad. We have a few basic responsibilities as a board, setting the strategic direction, setting the risk appetite and monitoring that risk performance as a board, but also monitoring the performance of our organisation against our strategic direction and our strategic priorities. And I hope that you'll see in the meeting today that we are very committed to doing that as effectively as we can. If during our meeting you notice that any of us are not looking directly at the camera, then please don't think that we're distracted or that we've suddenly become bored or anything of that type. It's just that we're probably looking at a separate screen in order to access the agenda and the papers. Mae gen ni gyfarfod eitha hir y bore yma, felly mi fydd na egwyl fel rhan o'r cyfarfod ac mi fyddwn ni'n disgwyl y byddwn ni'n cymryd yr egwyl yma o gwmpas 11 o'r gloch. There will be a break, a comfort break around about 11 o'clock for about a quarter of an hour as we go through our meeting today. And of course, just a little bit of an advert, we will be holding our annual general meeting this afternoon at 2 o'clock. That will be live streamed, and of course we will be delighted if as many people as possible were able to join us online for that meeting. Felly, y peth ola dwi am ddweud cyn bod ni'n symud i'r agenda go iawn fel petai, ydy jyst tynnu sylw at y cyd-destun a'r amgylchiadau dyn ni yn gweithredu o danyn nhw fel bwrdd ar hyn o bryd. Our Chief Executive, Hayley, will go into more detail, I'm sure, in her report, but just to mention that this continues to be a very, very challenging time for the NHS, not just in Wales, but across the UK. And yes, that is about finances, but I hope that what you will see in our discussions today is that as a board, despite the difficult challenges, we are absolutely committed to serving our patients and to meeting the needs of the Powys population to the best of our ability, particularly, of course, as the challenges of winter get closer and closer. So just with those opening remarks, we'll turn to the agenda, and the agenda and papers are available on our website for people to access. I won't go through the apologies because they should be appearing on a screen, but I just do want to add that our Director of Corporate Governance and our Board Secretary, Helen Bushell, a very key person in our governance arrangements here in Powys, although not technically a member of the board, but Helen can't be with us today because she's not well, and we certainly send her our best wishes. Felly, datganiadau o fuddiannau. Are there any declarations of interest from any members in relation to any items on the agenda? I know that Kate Wright, Ronnie Alexander and Katie Blackburn, because in previous meetings, have declared an interest in relation to the branch surgery closure in Gilwern. I will assume, unless anyone wants to say otherwise, that those declarations of interest still stand, and so those members will not participate in the discussion. However, Katie, as the Regional Director of Llais, may want to contribute from the perspective of Llais as an organisation. I'm not being told that that's any different. So we will accept those declarations of interest as we have done in previous meetings. So we turn to 1.3, item 1.3 of the agenda, and initially to my report as chair. As with many of the papers, I will take the papers as read. I don't have any additional comments to my report, but I'm happy to enter into discussion or to receive questions on any aspect of the report. Would anyone like to contribute? No? So I'm assuming that everyone's happy with the report unless indicated to the contrary. So we go to the Vice Chair's report, to Kirsty. Any additional comments, Kirsty?
Good morning, everybody. No, Carl, I'll follow your example. I'll take the short report as read and happy to answer any questions that colleagues may have.
Does anyone have any questions or want to enter into discussion with Kirsty about her report? No, so thank you, Kirsty, for that. And we turn then to our Chief Executive report and to Hayley. Any comments, Hayley?
Yeah, bore da, everyone. Yes, I would like to draw out a few points in my report this morning, because clearly we have been informed by Welsh Government that the health board status, we have changed from routine monitoring arrangements that we have been in for many years to enhanced monitoring status, and these are for the aspects of finance and planning. So we've been unable to meet our statutory duty to balance our finances over the 3-year period and unable to submit a balanced plan. So no health boards are currently in routine arrangements in Welsh against the Welsh Government's escalation and intervention framework. And as mentioned earlier by Carl, the finance and performance position is extremely challenging for the NHS and also for the wider public sector, as you know, the First Minister and others have indicated that the current financial gap and challenge for public services is the toughest that they have faced to date. We are now in ongoing dialogue with Welsh Government and have a meeting in the first week of October to fully understand the implications of the enhanced monitoring status. So we do know what that will mean so far is that it will step up the intensity of the scrutiny and assurance arrangements that we have in place with Welsh Government. And also we will be needing to discuss with them the detail of our financial plan for the remainder of the year, as well as going into the future years around the requirements to support us to get out from a deficit position. So just wanted to reassure board members that during this time we'll work tirelessly as a board to make sure that we're working with all of our partners across the whole system around our challenge, financial challenge. It'll be important for us to work within Powys, with the local authority, the third sector and other partners, statutory partners, because it's not just us that faces this public sector challenge, it is across the board. But also with other partners outside of Powys. We commission all of our services with neighbouring health boards across England and Wales, and we'll be needing to understand really how that financial recovery position across all of public sector services is going to be taken forward, and in particular the population of the cumulative impact of this on the population of Powys. I also know that just wanted to bring the board to the attention of the Bevan Commission work that's just been initiated to start a public conversation about the future shape of health and care. So I think that's quite an interesting and important piece of work for us to be a part of. The other couple of issues in my report that I felt I should highlight today is about the Speaking Up Safely framework that has been recently published by the Welsh Government. This is a really important piece of work, that we have the right culture in our organisation so that staff are able to speak up and are supported. It's a really courageous thing to speak up and speak out, and we need to make sure that we have the right support mechanisms in place across the organisation and the right culture to make sure that that is done well. So we will be reporting back to the Workforce and Culture Committee on the progress of our self-assessment against the new Speaking Up Safely framework. We were particularly, you'll see later on the agenda, a couple of papers around model standing orders, etc. to approve, and I think the context of the additional work that's being undertaken at the moment to establish the new commissioning joint committee, national commissioning joint committee for Wales to pick up the functions of Welsh Health Specialised Services Commissioning, Emergency Ambulance Services Commissioning, and the National Collaborative Commissioning Unit. I have attended the first two meetings of the implementation board, and we will keep the board posted through committee and board meetings on the progress of this work to establish this new National Commissioning Joint Committee by the 1st of April. And then there are other things in the report, but I just, because of the particular press coverage at the moment around the reinforced autoclaved aerated concrete, just wanted to reassure the board that we pick this up in Delivery and Performance Committee. There's a piece of independent work that's been undertaken by surveyors to check our position, and for once we don't have a problem. I think that's a position because we have such an older estate in Powys, but we have found that there to be no high risk rack constructed floor or roof decks across our estate. So those are the key areas I wanted to particularly highlight this morning. Thank you.
Thank you, Hayley. Would anyone like to contribute or comment, ask a question?
Chair, for me, Simon.
Simon, please, yes.
Thank you for your report, Hayley. Really helpful. Just on the escalation activity, and a question, and to seek some reassurance really about that is going to be more work for parts of the health board, and just to ask you and seek some reassurance about how far does that start to impact on frontline services to the population of Powys first off. Second question on national commissioning. Do we get any sense of that securing cost reductions and helping in any material way to the current cost pressures facing NHS Wales across the board?
Thank you, Simon. Really, both very, very relevant questions. So on your first point, which is how are we going to manage the enhanced arrangements, really, the additional capacity to deliver our relationship that we need with Welsh Government to show them that we're on the right track. So my view is on this, Simon, is that there's very little extra work that we need to do as an organisation because we're already on it in terms of the work that we were already doing around our financial position, our plan. And you know, that is a core part of our business currently, so it's a continuation of the ongoing focus on that work. What it will mean is that the interface meetings that we have with Welsh Government will increase. So we will have gone probably from quarterly meetings currently to monthly interface meetings. And my view on this, and we've talked about it as an executive team, is that we need to hold that space as best we can to avoid the broader organisation being drawn, the capacity being drawn into those interface meetings, because it is really important. We've got a lot of work to do. It's important for Welsh Government to seek further assurances around our progress, and I understand it wasn't a surprise to us that we've moved up in our escalation status, but we will need to make sure that that doesn't detract from the work that we've got to get done to actually improve the position. So my view is that particularly key members of the executive team and at the very senior level of the organisation will manage those interface meetings with Welsh Government. As we proceed, I know Welsh Government are currently updating their escalation framework, and we will share that proactively with the board as it's published. We've seen an early draft, and we will be able to share that very soon. So I think it's about more doing the same of what we were already doing, but actually increasing that conversation and dialogue with Welsh Government so that they can take assurance that we've got the right grip and control on the measures that we need to take. So my view is we'll be able to manage that at an executive level. The second point, which is around the national commissioning function, I mean, I think it's really interesting, the recommendations that came from that work, and it was particularly about recognising that we need to consolidate our expertise and a capacity around commissioning nationally. I do expect we have in our first and second meeting talked about some strategic principles that support that work being undertaken, and part of that is making sure that the new joint committee is operating as efficiently and as effectively as possible. They already, in their separate sort of functions, currently have cost reduction programmes to deliver, Simon, and clearly quite challenging financial plans as well. But I think we will be looking to make sure that the new joint committee does have economies of scale and that we are able to deliver a more efficient approach across the commissioning functions in Wales. It's too early to answer the question specifically at the moment, Simon, about whether that will be realised, but I think that's one of the strategic principles we've set for the new committee to make sure that they're running as efficiently and as effectively as possible, and their contribution to us is important because it is still will be a joint committee comprising all of the health boards across Wales, because we are still got the authority and accountability to commission those services within our respective health boards. So we'll keep you posted on the progress that we make on that.
Thank you on both fronts. Thank you.
Thank you. Ronnie, please.
Thank you. Hayley, as Simon has said, thank you for a very helpful report. I have two questions, one of which refers back to the Ombudsman report that Carl has referenced. And the first thing I want to say is it is a report this time around which is rather more user-friendly than has been the case in previous iterations, and I think that's a consequence of the appointment of the relatively new Ombudsman. But it seems to me that the increased use of informatics and making the report more user-friendly does actually bear testament to the fact that you can reduce dense text to, as it were, to readable content. And I think it behoves any organisation to look at that and see if there are any lessons that can usefully be learned. My second point in relation to the Ombudsman report is that as I read it, and I'm open to correction on the point, the Ombudsman staff are offering to train the staff of other organisations in complaint handling. And I just wondered if that was an opportunity for any of the staff involved in complaint handling at Powys Teaching Health Board. My second main question, and you will not be surprised as to this, relates to COVID, and in particular the interview yesterday given by the CMO, in which he encouraged everyone to be very vigilant as to COVID, and particularly the possible significance of the new variant in close settings such as care homes, hospitals, and so on. And I'm conscious that the air traffic control staff at Gatwick are unfortunately fairly well decimated by COVID at the moment, and that's affecting the number of flights that can take place from that airport. So this is just an example of how COVID can affect that close association of people working or being together. So I'm just seeking assurance that we have proper contingency arrangements in place to cope with what may be coming around the corner. Thank you.
Thank you, Ronnie. Really good questions again. And if it's okay, Chair, I'm going to ask Claire Roach to come in and respond around the Public Ombudsman and the training question. And then Mez, just a bit of warning, Mez wondered whether you would like to come in and comment around the questions that have been raised about our ability to respond, contingency plans to respond to COVID. Is that okay? Thank you.
By all means. Thank you, Claire.
Yeah, thank you very much, Hayley, and thank you for the question, Ronnie. Obviously, we received that report from the Public Service Ombudsman and acknowledged everything that was in there. Just in terms of the training, we absolutely will be open to any offer of additional training from the Public Service Ombudsman. And actually, during the last 18 months, we have worked really closely with the Public Service Ombudsman for Wales office to be able to really strengthen our links and our partnership with them. And we've also worked really hard within the Health Board to actually do a lot of training actually within the Health Board for our staff across the organisation. Directly from the Quality and Safety team in the Corporate Nursing Directorate. And as a result of that, one of the things that we are seeing, which is really positive, is that we are seeing an increase in our number of concerns and complaints that are being handled in an early resolution way. So, you know, what used to be termed as on-the-spot complaints, and we're seeing a reduction in the percentage of our complaints that are progressing to formal complaints. We've also done a survey with people who have made complaints or concerns within the organisation within the last year, and interestingly, over 89% of them stated satisfaction with how they raised those concerns. So there are a number of key indicators that we are monitoring to be able to ensure our sustained improved performance with the handling of formal concerns and responding to complainants in a timely way.
Thank you very much, Claire. And over to Mererid. Diolch, Mererid.
Bore da, diolch yn fawr. Thank you, Ronnie. So in terms, as you've mentioned, that a report of a new variant, BA 2.86, that they're naming it, is being monitored closely nationally at UK level. It is too early to understand the impact and severity of this variant, but notwithstanding that, you know, we are seeing currently an increase in COVID cases in our communities, and this has mainly been driven by multivariants that have been circulating for a while, and is likely to be a challenging autumn and winter. We do have plans in place, and that includes, surveillance and case sort of management. We work closely with the local authority and the former TTP, which is now the Health Protection Service, monitor current cases, provide support into vulnerable settings, and we formulate IMTs, incident management sort of team and reports and outbreak plans in place. And we also have surge arrangements in place. And then proactive actions that we've already taken is that we started the vaccination programme earlier this month, and we visited all care homes as a priority within that programme. Within the Health Board as well, we have taken IP&C precautions, and colleagues may wish to come in on that, particularly Claire, if she wants to add anything. So that answers your questions, but happy to come in further if that would be helpful.
Thank you, that's very helpful in respect of both questions.
Thank you. I can't see anyone else wanting to come in with anything else. So if there are no additional comments from you, Hayley, I think we'll thank you for your report and for the discussion, or is there anything?
There was one point just
Okay.
I forgot to mention, apologies, I was looking at my list, I thought, right, okay. So I just wanted people to be aware that a joint inspection of child protection arrangements is now underway in Powys, and this is a really excellent opportunity to review, learn and improve the way we protect and safeguard children in the county. This is a really comprehensive inspection, and it involves education, ESTIN, HIW, Care Inspectorate Wales, and also His Majesty's Inspectorate of Constabulary and Fire and Rescue Services. So it's a really meaty sort of joint inspection, and that capacity of the teams are currently working alongside to make sure that we participate and get the maximum amount of learning from that review process. So I felt it should be mentioned today. Thank you.
No, thank you, Hayley. It might just be worth as well just explaining in this public space, what happens to that learning, which committee will deal with it, and so how will we as a board manage that learning?
Yeah, it will come through the Patient Experience and Quality Safety Committee in the first instance, and the broader learning will be shared across the whole board as well. The timescales of that work it's just at the start of the field work now, so it'll be coming through probably. I'm checking on the timescale, and I saw Nina had joined us as well. Welcome, Nina, from the local authority. Thank you for joining. I think it will probably be later this year or early next year by the time we get the learning report out from this inspection. Thank you.
Thank you. Okay, well thank you for that. We'll move on to the next item on our agenda, item 1.4, and as we remind ourselves, our subcommittees as a board are really key. They do the heavy lifting, as it were, as regards scrutiny for us as a board. They get into the detail that perhaps the full board in this kind of meeting doesn't have the time or capacity to do, and therefore they are very important sources of assurance, and the chairs of those committees therefore are key people as sources of that assurance. We have a small number of reports today from our executive committee and from the DMP, the Delivery and Performance Committee. Hayley chairs the executive committee. Again, coming to you, Hayley, do you have any additional comments that you'd like to make?
No, not particularly. I take the report as read, but you can see the wealth of information and topic areas that we covered over the period of July to the 6th of September. So no, I didn't want to particularly highlight anything, Carl. Just happy to take any comments or questions.
Thank you. Please indicate if you would like to come in with any comment or question as regards the executive committee report. No, thank you. If not, we move on to the Delivery and Performance Committee, and I do want to put on record our thanks to Ronnie who is chairing this committee because Mark, our usual chair, is unwell currently. So thank you, Ronnie, for stepping into that role. Again, any additional comments from you, Ronnie, as regards the report?
No, thank you, Carl. We had an earnest consideration of the items on the agenda, and it did lead to a somewhat lengthy but appropriately focused meeting. I'm just taking the report as read, but again, happy to answer any questions.
Are there any questions for Ronnie in relation to the DMP report? No, I mean, just for tidiness more than anything, Ronnie, I will come back to you later on in the agenda when we come to the performance reports, just to give you an opportunity to note the outcome of your discussions as a committee on those reports. But thank you for the report. So we received the summary assurance reports, and we receive them as a source of assurance. As always, I will assume that everyone supports the recommendations, but please do indicate if anyone doesn't or would like to dissent, as it were, from that support. Nope. So that is supported. We turn now to the minutes of our last meeting, item 2.1 on the agenda. Initially, for accuracy, are there any corrections or amendments that anyone would like to suggest? No, so we accept those as a correct record. Turning our attention then to the action log, and in the absence of Helen, our board secretary, I'll turn to you, Hayley, as to whether you have any comments on the progress of the actions on the action log.
Not particularly to highlight today, Carl. Happy to take any queries or questions from members.
Okay, thank you. Ian, please.
Yes, thanks for that. Just a further reflection on the piece in relation to the digital strategic plan. I didn't want to get into a conversation about the accuracy of the minutes particularly. I think for me, on further reflection, I think we've missed a step here. We've gone from our vision into annual plans, and the bit that's missing for me, and I think the bit that we as a board need some scrutiny over, is the overall plan to deliver that vision. I don't think it's possible to go from vision into individual annual implementation plans in the absence of the context of what are the steps, not just this year, but next year, the year after, and the year after that. So for me, I think the scrutiny of the Delivery and Performance Committee, that is what we've agreed. But I think we also need, before we get into the annual plan, and this is my recollection of the discussion and the points that I made at that meeting, is that we need that overall plan, if you like, or as I'm describing it, a route map that then get into that. So I think that's pertinent in terms of the actions, because for me at the moment they're missing a stage, and it's a really, really important stage. I think the board needs sight of what all of the issues are to deliver that vision, how long it's going to take us to get there. It's an extremely ambitious vision. We need an equally ambitious overarching plan that set out clearly the steps and the timescales and the resources involved. Thank you.
Thank you. Pete, would you like to respond to that, please?
Yeah, thanks, Ian. So I think you're referencing the digital strategy in the strategic framework in the first instance. You mentioned a plan. I'm not sure if you remember in the presentation that was given alongside the strategic framework at the board, and actually in the board development session when we looked at the framework, which had that one-page sort of roadmap which identified against our 5 key themes the key actions to be delivered in year 1, year 2, year 3. So I think that's what you're describing, that tries to pull that together. Obviously, then as you work into the detailed delivery deployment part of it, that's when you build up the actual actions and against the programs of work that will deliver against those key aims. So I think that was covered in the previous board, but obviously we can reflect on your comments and make sure that we report accordingly to Delivery and Performance Committee, and then as that filters up to the board as needed. So more than happy to pick up on that and then pick up outside of the board to make sure we reflect the ask.
Thank you.
Thank you. And so we go to Ronnie, please.
Thank you, Carl. I just had a question in relation to cochlear implant and bone conduction services, and I'm particularly seized of the importance of these services in terms of their significance for children. And I understand that there are some long waiting lists at the moment, and I was just anxious to be assured that those long waiting lists were not adversely affecting children. Thank you.
Who's best placed to respond to that, Hayley?
Could I ask Steve to come in on that, if that's okay, please, Carl?
Thank you, Steve. You're on mute, Steve.
Apologies, Chair. Morning all, and we are having some connection problems to this meeting in Bonflas today for those of us that are here. So Ronnie, thanks for the question. It's difficult really, to be honest, because those services are very specialised in nature, as you can imagine. But I don't think the children will be necessarily disproportionately affected. It's just that in the round of the waiting list position at present, they will be in those queues along with adults. So that's probably the only comment I can give at this time. We're actively reviewing all waiting lists for both adults and children constantly to see what access can be improved upon.
And Carl, just if I could just pick up on that, I think it'd be probably quite helpful for us to just bring that breakdown through to a committee meeting of the latest position. But fundamentally, the long wait, as I know, is around this particular service, but unfortunately, long wait does have an impact. What we have done is that work, as you say, to be able to see that by age, so we can see children alongside adults, and we could probably provide that in the next report that comes through to the Delivery and Performance Committee, if that's okay.
Thank you, Hayley. Is that okay, Ronnie? Are you satisfied?
Thank you. What I have in mind particularly is the significance, particularly of children who are congenitally deaf, and I understand that actually, you know, having some, as it were, improvement in their hearing condition before 3 is actually fairly crucial. So that was my primary concern. Thank you.
Thank you, Ronnie. Kirsty, please.
I just wanted to reassure Ronnie that the issue of long waits for children is regularly discussed at the WISC Patient Safety and Quality Committee, because many services for children are commissioned on that basis. And I know that this has been a particular concern for Hayley and previously Carol when attending the executives meeting, but independent members scrutinise the position with regards to children's services, and I'm pleased to report at present the projection for services, certainly for commission on a WISC basis, are in line to meet government expectations at this time. So that service is regularly reviewed by WISC, and I, as a member of that committee, continue to press hard on assurances around access to paediatric cardiology and paediatric surgery, because we are very conscious not of the point that Ronnie just made around the impact on long waits for all aspects of children's treatment and what that means for their development and or their education.
Really helpful. Thank you, Kirsty. So I can't see that anyone else wants to come in at this stage. So if not, then we'll we'll move on from the action log to item 2.2 on our agenda. We have 4 sets of standing financial instructions and standing orders to which changes have been made to approve. So in the absence of Helen, once again, I think Hayley's going to step into the breach. I suggest, Hayley, that we move through them one by one and see how we get on. So first of all, the standing financial instructions and standing orders for EASC. Any additional comments, Hayley?
Not particularly. I mean, this is an annual review that's undertaken, and EASC had considered this as beforehand, before coming through to the board for approval. I mentioned earlier about the new body, the new joint committee that will be established from the 1st of April. So this will be coming back quite soon again, Carl, in terms of the model standing financial instructions and standing orders for the new joint committee. So this is to take us to the end of this financial year. Nothing to particularly highlight, just to reassure you that it has gone through EASC and now comes to the respective health boards for final approval.
Thank you. Does anyone want to come in as regards to the EASC document? No. Okay, so let's move on. So I'm assuming then, I will assume that everyone approves that, unless you want to indicate to the contrary. No, so we move on to WISC. Hayley?
Yes, same position with this, that this will apply till the end of the financial year, until the new joint committee is established. Again, wouldn't highlight anything in particular, just here for comment and for approval.
Does anyone want to comment? No, so we approve that, and we go on to Appendix E of our own standing financial instructions. Hayley?
Yeah, thank you. So this hasn't been anywhere else. This is coming to us for approval. From the point of view of this work, this has been done across Wales in conjunction with all the other health boards. And the main changes that have been included is a reference to the Health and Social Care Quality and Engagement Wales Act, and also the really important changes to reflect Llais being established as the National Citizens' Voice body.
Would anyone like to come in? No, so again, we approve those. And before we go on to ratify, I suppose I didn't want to come in, Hayley. The only point I would make, the pedant that I am, is that is that they wouldn't benefit from a proofread. But as I say, that's a small point, and it's just a stylistic point, really. But so we're asked now to ratify the application of the Common Seal, and to be assured that these actions were taken in accordance with our own standing orders. Hayley?
Yeah, just one today for the board to ratify, and that was the affixing of the Common Seal for extending the lease contract at Llanfyllin Library.
Any comment from anyone? No, so we ratify that application, and we are assured that that it was applied appropriately. Thank you. So we move on to 3.1 on our agenda, and to our performance reports. We have 2 reports for consideration today, which is our integrated performance report for month 3, before we go on to the Q1 delivery plan. And our Director of Performance Commissioning, Steve Powell, will add comments or introduce this item. Thank you, Steve.
Thank you, Chair. So colleagues, this is on page 310 of the board pack issued. There's a 6-page cover report and then a 74-page detailed performance report to accompany the position to the end of month 3. The report itself is a little bit longer this month than previous months, as we've sought to incorporate all the new performance measures for the 23-24 performance framework that has been issued. We've documented the changes from last year to this year, as a result, and those changes are captured in page 3 of the cover report, but also in a detailed appendix at appendix 2. Page 3 of the report summarises the performance challenges that the Health Board experiences, both from a commission perspective, and those are largely around all of the access criteria for A&E, cancer targets, diagnostics, and referral to treatment times. And as a provider, we are experiencing some challenges also in terms of therapy services and some of the access around general surgery and rheumatology services that we provide. Page 4 of the report summarises our performance against the quadruple aims, because they are still part of our overall performance measurement in the Welsh NHS. And page 5 describes our performance against the ministerial measures, and those are an important set of measures that are in situ this year in order to measure our overall performance as a health board, with particular focus on reduction in long waits and improvement to access. And so the ministerial measures, they do report that we are currently off track on four of those measures, but we've got remedial action plans in place to improve performance across the remainder of the year. The detailed report itself, I'll take as read, and I'm happy to take any questions, and I may need to invite other director colleagues in to assist on those responses. Thank you.
Thank you. So we'll go first to Kirsty, please.
Thank you, Stephen. I wonder if I could ask you a question about the long waits. So obviously, as you said, this is a ministerial priority, and all health boards will have been given an allocation of additional financial resource to try and address long waits. I'm just wondering how we as Powers are going to ensure that our neighbouring health boards who we commission services from will include Powers patients in their long wait initiatives, so they won't just focus on their own long waiters, but actually we will have a fair proportion of our long waiters addressed, and also that we don't have to pay twice for that, so that does not come off. So that activity is our additional to the commissioning that we already do. So I'm just wondering how we will be in a position to monitor fair access to Powers patients to long wait initiatives from neighbouring health boards, and again that we are treated fairly from a financial perspective and how they are dealt with. Thank you.
Thank you, Kirsty. So on the first one around proportionate representation, if you like, of Powers patients. So typically when a provider books patients, they don't look at where the patients are from. So they will just treat the patients based on clinical need and clinical prioritisation, as opposed to what health board they're resident in. And that's the same issue with the English Trust that we commission off. So we can also review that from a numerical perspective when we look at the number of patients going through those providers at any given times. So we do undertake those checks, Kirsty, and I've never noticed any postcode lottery, shall we say, in terms of access being given to Powers patients. On the money question, particular allocation has been given to Welsh health boards in the current financial year. An extra 50 million has been made available, and we have had 1 million of that extra 50 million to improve waiting times. The allocation that we received specifically said that we should not be billed twice for patients that are being treated in those other health boards, because the Welsh Government has given those health boards the money direct. So again, in the background, we've got a mechanism that we've put in place to ensure that we're not being billed twice for that level of activity. Thank you.
Kirsty, okay?
Yes, that's great. Thank you very much.
Thank you. And Robert, please.
Thank you. Stephen, two questions I think that apply equally to this and the next item. First of all, yesterday we attended one of our hospitals with an operating theatre. So my question is, what are the barriers to utilising our theatres even more, or have we gone as far as we can for the foreseeable future? And then my second question, we note the pressures on emergency departments in DGHs, and RMBERN are proposing reducing MIU opening hours in some hospitals. Can we have a reassurance that the overall picture will be reviewed, kept under review, so that Powys residents will not have to go to DGHs for relatively minor injuries and so add to the burden of those departments? Thank you.
Thank you, Robert. So our own operating theatres, we could use them more, but staffing is the constraint. So whether that means staffing that we receive from other health boards, consultant and anaesthetist to come into Paris to provide those sessions, or the number of staff that we're able to employ and then deploy ourselves. It is something that we're actively working on because it's a key component of our plan, both now and in the future, to deliver as much day case in Paris as safe and sustainable to do so. But the staffing is the limiting factor, as it is across other health boards and trusts that we commission of, in terms of full utilisation of planned care theatre sessions. The NHS has just called for a piece of analytical review to be undertaken on theatre utilisation in this very lane, Robert, that you're querying, because the physical capacity is available, but staffing is the constraint, and obviously the aim is to try and maximise the use of those facilities to improve backlogs. But as I said, the staffing is the challenge. And on the second question, whether I can give you assurance that patients won't go to DGHs if MIUs alter their opening hours. I mean, at the present time, I probably can't give that assurance until we've done further detailed work on that area. But what we do know, for those health boards that are suggesting a change to MIU hours, they're typically doing it because the number of patients who are attending those units are very few in number out of hours, and so it is also likely, therefore, that the number of Powys patients accessing those patients is also few in total also. So that doesn't mean to say we're being complacent. We will be working with each of those providers, suggesting a change to their MIU as part of the overall consideration of those changes. Yeah.
Thank you, Steve. Robert isn't indicating he wants to come back. Please do if you do, Robert. But just picking up on Robert's point, Steve, before and I want to bring Joy in as well. It's that cooperation, isn't it, and coordination with other health boards. I mean, MIU is an illustration of that. How sure are you that we don't get surprised or tripped up by other people's decisions, and how coordinated is the system?
For the majority of the time, because the system is well coordinated, there are the odd occasion where a health board or an English trust may announce something as an urgent service change that we're not cited on, and we arguably should be. I think some of the comments generated today may be due to the announcement by an RMBERN Health Board with Neville Hall Hospital. So I am actually meeting my equivalent tomorrow to just go over that proposal and what more could we have done to sort of be a bit more cited on that particular issue.
Thank you. Joy, do you have anything to add, please?
Just a very small point, Chair. In terms of our own MIUs here in Powys, again, overnight usage by our Powys population and others, including visitors, is extremely small. and we just provide assurance that we continue to monitor take up of MIU services extremely closely, and continue to liaise with all of our partners, neighbouring health boards and English health boards as well, to make sure that there is that quality of access, and that we are cited, and that we seek to represent the Powys view as we as changes happen within the infrastructure around us.
Thank you. Hayley, do you want to come in on this point? Because I've got Jen that also wants to come in, but if you want to come in on this point, please do.
Yeah, thank you. It is on this point. So I think the scale of the challenge that the NHS is currently facing, whether that be from the staffing, recruitment, retention, some of the gaps that we've got in both clinical and medical workforce, as well as the sort of financial pressures that we're all managing. I think increasingly the work that we've been doing around bringing strategic change reporting and that coordination of our work across our neighbouring health boards is even more important than ever now. So I know that Steve mentioned specifically around MIU in response to Robert's questions, but I think there's a broader point here that I just wanted the board to be aware of, that actually the tracking of any changes to services or pathways or decisions is a key piece of work that it's very hard for us in Powys, as Llais can understand as well, because our population goes everywhere. So our pathways are complex, they go to a number of providers, so it's not about being able to manage this work within Powys, but it is about understanding the impact of our neighbouring health boards and trusts changes on our population. And, you know, through our contract quality performance review meetings, we remind each of the health boards and trusts about the need to make sure that they engage or consult for the catchment population that they serve, not their resident population, and a number of them do cover us. So, and, you know, generally I'd say it works well. I agree with Steve, it works well. There will always be occasions where things don't quite go to plan. And usually it's because of urgent changes that come about, whereby the pace at which the decision making is done has meant that we kick in with that more sort of catchment population conversation with us a little bit later. But I think through Steve's work and connection with the planning directors of each of the organisations, as well as the shared knowledge that we have day to day with Llais, I'm confident even if we're a week or so, a few days behind, we will catch up very quickly and make sure that our responsibility to engage with the public and to respond appropriately will be managed. Sometimes we're a few days late in starting that work, Chair, which is never ideal, but generally I think we do it very well.
Thank you, Hayley. So over to you, Jen. Thank you.
Diolch, Carl. Actually, I think as the conversation has evolved and the debate has evolved around this issue, I think my question has been answered, but I would just like to raise it anyway, just in case there are other items that Hayley or Steve or Joy might want to comment on. And my focus is very much on the recommendation section of the paper, that second recommendation where the executive, you're asking us to take assurance that the health board has appropriate systems in place to monitor performance and respond to relevant issues. Absolutely take assurance that we have appropriate systems in place to monitor performance. And I was going to ask about what's our work looking like in terms of responding to relevant issues, but the responses that you've given to Kirsty and to other questions, I think, are evidence of the way that you are responding. We are responding, I should say, I beg your pardon, to these issues. Given, I suppose, the one thing I would say that or ask is that given sort of, as I think I'm reading this right, sort of the escalation and how tough it is out there right now, I can really see that we are working hard on understanding what that picture looks like, and so monitoring that performance, and we have made changes in that respect in terms of our learning and continuously improving in that regard. I would like to take assurance, I'm sure that you are, but that we are also continuously improving on the way we respond to those issues, and that we are doing maybe something differently now than from when we were 6 months ago, because the situation is different, and therefore we're having to adjust, we're having to be agile to respond to what's out there. So my question was, I think I have got the evidence of it, and I do take assurance that we are we've got the appropriate systems in place to respond, but I would love to get from you a sense of how we are learning as we are doing this to be even better, because we know sort of what's coming around the corner. We know this is not going to get better in the next 3 weeks, etc. So do you see a sense behind my question? Thank you.
Yes, I do. Thank you, Jennifer. So for our own services that we provide, the team are spending more time with the service managers to understand our performance in a greater level of detail, and where we're off target, for example, what actions are actually being made to improve performance, and then we'll report then on our delivery confidence assessment, if you like, around return to compliance. So, and then for commission services, it's a standing agenda item that we discuss performance in depth with all of the providers that we commission our services off. And I've asked the team to review the performance trajectories of those other health boards and English trusts to see where we believe they will end up during this financial year, both from a financial perspective, but also a performance perspective, because that gives us that insight into performance, but also it sets the scene for the challenges for next year's planning, because this year's outcome will become the start point for next year, and it's important that we fully understand that position also. Thank you.
Thank you very much, Stephen. Katie from Llais would like to also make an observation. So please, Katie.
Thank you, Chair. I'm going to pick some of what's been discussed up in my report, if that's okay, but I just thought it was opportune to make the observation that from Llais's perspective, the Health Board has got very strong systems in place to actually monitor service change that is going on, and that service change is actually shared with us on a regular basis. So from a Llais perspective, the issue for us is when other health boards don't share that information. So once the health board has got the information, then those systems are there. So Steve meeting AB tomorrow is really, really positive, but it has been an ongoing issue that either Llais or the health board sometimes, not always, sometimes pick things up. I picked the minor injury unit up and shared it with Adrian. It should have come from an Iron Bevan Health Board. So it is about, I think, the strengthening and making sure that those systems are in place from other health boards' perspectives. They have a responsibility in this too.
Thank you, Katie. So just before we bring we move on to our next performance report, Hayley, do you have any? Would you like to come in at this point?
Thank you. I think that the learning point is really important, and you know, Steve's given the reflections of how we do that within House, but I just wanted to share a little bit about some of the ways in which we share to regional and national level as well. So we are part, you know, we've mentioned before about getting it right first time, and some of the work that we've done across individual specialties around that. The whole purpose about that is about sharing good practice, knowing what good looks like, and actually supporting each other to get better across the system. So that's one example I just wanted to give you some assurance that we do it locally, but it's also in that sort of national context, and also some of the work that's been undertaken at key priorities at the moment that we're all struggling with. For example, prescribing medicines management, work around continuing healthcare. There are national work streams that have been established to look at this across Wales, and one of the first tasks is making sure that we understand what the position is across the whole of Wales, and the second then is identifying those areas of good practice that maybe some areas have gone for that others haven't considered, and seeing, okay, well, why can't we scale up and do that in other parts of Wales? So just wanted to sort of pick that up, and in particular, I'm sure Joy might want to give a practical example, Carl, perhaps of a learning example that would bring it to life. Perhaps Joy, do you want to bring bring an example in? Thanks.
Yeah. So I'm just going to ask for a brevity, Joy, if you would please. You know, we just need to move on to the next report at this point. But thank you, Joy.
Certainly. So, you know, thank you, Jen. Your question is really, really important. So if I may illustrate from a mental health example, we know from the data that we get from Steve's department that our short-term interventions within 28 days of assessment is a real challenge, and it's a challenge right across Wales. And it's a challenge of resource in terms of clinicians, and it's a challenge about the availability of clinicians as well. So the answer isn't as cheap as just more money at the service. So, for example, we use this intelligence then to make sure that we send patients for rapid access to help and support at the time. So, for example, patients waiting for short interventions in talking therapies, that's different to psychology, but counselling, EMDR, some of those CBT services, we are actively sending patients that when they feel a period of distress or crisis, we're sending them to 111 Press 2 for a short-term immediate response to assist, or to services where people can help themselves in terms of CBT, like Silver Cloud. So what we're seeking to do is a very agile system of response when some of the challenges around performance are really quite structural and are due to availability and scarcity of clinicians.
Thank you, Joy. Thank you very much indeed. The recommendation in terms of this item is that we discuss and note the content of the report. I think that's certainly been done. Importantly, that we take assurance, as Jen has very effectively highlighted, that as a health board, we have the systems in place to monitor performance and to respond to relevant issues. Would you indicate if you don't support that recommendation? Thank you. That is supported unanimously. So we turn to our second performance report, the Q1 delivery report. Again, additional comments, Steve, please.
Yeah, thank you, Chair. So again, page 393 of the board pack. This is a position to the end of Q1 of the current financial year. And at the time of writing, and also still remains the case, our plan is actually not approved by Welsh Government, along with all other health boards, for some of the reasons that Hayley outlined at the start of this meeting around the overall financial position of the health board. But it still remains our plan for the health board to deliver against. We've made some improvements to the report for this financial year in terms of overall visual assessment of how we're getting on through the use of pie charts. And we've also included a delivery confidence assessment around how we believe the forecast outturn for each of our measures will be delivered or not. Page 3 of the report goes on to describe that this is an executive-led process, so each exec, in terms of the deployment of their portfolio, has signed off and agreed the performance output at Q3, and that's important in terms of governance and oversight and accountability within the delivery of our plan. And in terms of next steps, because the overall financial challenge and operational challenge of the NHS at the present time, we are reviewing some of the planned activities for the remaining 6 months to see if they still fit in the current climate. So if we do have to change some of the deployment of our plan, we will bring that through as a change to board to endorse that change if required. The detailed report itself, page 3 of the report, all the pie charts, shows that in total we're making good progress against our plan at the end of Q1, and that is really important, as Hayley and others will comment upon. The delivery of our plan this year is an absolute must-do, both financially, operationally, and so at the moment we're at Q1, we've got some challenges, but overall progress is positive. I'll pause there, Chair, and invite other colleagues in if necessary to respond to any questions. Thank you.
Thank you. Does anyone want to come in with a question or a comment in relation to the delivery plan report? No one indicating as yet. So, Steve, I was just wondering, you mentioned other colleagues. I wondered whether any of your exec colleagues might want to come in with any additional information or comment as regards the report. Yeah, Hayley?
Yeah, I'm quite happy to come in. So I think that the position, we always find this with Q1 reporting, Chair, there's a bit of a pattern. So some of the additional priorities that we've set in year, as you see moving forward during the year, I just wanted to say that that confidence assessment point that Stephen raised is really important. We find sometimes there's quite a bit of scoping and initial work needed in the first quarter or two, and then we start moving into delivery and impact in Q3, 4. So I think the key issue for me is at this stage, we're not indicating any issues that we're not going to deliver our plan, and that's the key message that we've got. We'd like to that's a good position for us. We're on track around our delivery, and I think it's an important point because it has been in a time of particular pressures as well, and as we go into the winter period, we have always had to be fairly agile about some key pieces of work in that sort of Q3, Q4 period, but we will let you know if there are any changes that we need to make to the plan. But at this moment in time, as we're presenting on Q1, we're on track and we're still saying we're going to deliver the plan that we submitted to Welsh Government at the beginning of the year. Thanks.
Thank you. I can't see anyone wanting to come in and contribute to the discussion. I'm just pausing a little bit so that people do have time to come in if they want to. But no, so thank you, Steve, and thank you for those 2 reports, and indeed for all the work that goes on by you and your team in not just in providing the reports, but keeping us on track in terms of that performance and so on. Much appreciated. So once again, we're asked to receive the report as an update of progress against the plan, and take assurance that we have the systems in place to monitor that performance against the integrated plan. No one's indicating that they don't support the recommendations, so I will take it that we support that recommendation unanimously. Thank you very much. We move on to money and to Pete and the financial performance report. Thank you, Pete.
Yeah, thank you, Carl. So the finance report is included in everyone's pack in the usual format. As per normal, I will reference the key points and issues, and we can pick up on any queries raised. So this is the financial report for the end of month 5, the end of August. What I will do is reference the actual report page numbers to help those listening. So as at page 1, as of month 5, we are £14.277 million overspent. As a reminder that we've got a deficit plan of £33.5 million. So as at month 5, we're £329,000 off profile against that plan. We are continuing to hold our forecast to meet that deficit of £33.5 million. Included in the position are key risk areas which have been consistent in recent months and in previous years are our commissioning position. That's mainly in relation to increased emergency admissions and the challenge of delivering savings in that area. Ongoing pressure in relation to primary care prescribing. Our continuing spend on agency to cover vacancies and other staff requirements. I do note there has been some improvement in month, but still the level is higher than in previous years, and ongoing pressure in relation to our continuing healthcare. Included on pages 2, 3, 4 and 5 are further analysis of those areas which show the trends in year compared to previous years. And then also to note that our capital position is on track to deliver as per our plan. So we have a total capital resource limit of 3.656 million. For the year to date, we've got a spend profile of 0.513 million, and we're on track to deliver against our capital resource limit. If I just reference onto page 6, this is in terms of our requirement to deliver £7.5 million worth of savings and mitigating actions within our plan. This is required to be delivered to meet the 33.5 million deficit. Our progress is in a reasonable position, whereby we have 7.6 million, slightly above the target, covered by now green and amber schemes. The detail is included on the table in page 6 of the report. I think the key thing to mention is that it's important that we push to move those amber schemes to green, obviously to give total confidence of delivery, and also to note that some of our savings are being delivered on a non-recurrent basis. Obviously, anything that we do non-recurrently continues to be a requirement as we move into next year. So the more we can do recurrently, the more that we can improve our ASK for next year. And just generally, we've been talking about the financial pressures that we're facing at the moment. Just a reminder that the key message to every area and every budget holder is to reduce their expenditure run rate wherever possible, and to do that on a recurrent basis where possible to help as we move into next year's financial plan. So, Carl, I'll pause there. They're the key issues, key points, and happily to take any questions, comments.
Thank you very much, Pete. Anyone wanting to come in with a question or comment as regards the finance report? Please, Ronnie.
Thank you, Carl. Just an observation really in relation to agency spend. One of the complications in relation to that particular dynamic was a salary increase for staff that came along, or an increase in agency cost as a consequence of staffing increases in pay. My question is, are there any other such increases down the track, or is that something that's happened once this year and will not reoccur? Thank you.
Thank you, Ronnie. So I think you're asking, are we expecting any further increase in agency rates in the year? At the moment, I'm not aware of any likely increases, but obviously that part of the market is not something that we control. But that is why we focus on using on contract agencies, because those agencies which are on contract have been through that national procurement process, and there is a greater certainty in relation to the costs, and is an element of control and certainty going forward.
Thank you.
Kirsty.
Pete, one of the areas that we're experiencing some pressure is around primary care, and in particular prescribing in primary care. And I'm just wondering whether what actions are possible to address that, given that some of that is driven by supply chain issues, which are driving up the costs of many commonly prescribed medications, and that seems, out of our control really to be able to do anything about that. So I'm just wondering, what actions can we take that are feasible and are within our control in that particular area of pressure, when it seems that quite some of that is outside of our control.
Yeah, thank you, Kirsty. And I'll make a quick comment, and then Kate may want to come in relation to the meds management issue. I think you're right in terms of inflationary pressures, availability of stock pressures. They are very difficult for us to control. But what we do is we focus on our own data and intelligence to identify where there may be prescribing patterns which could be improved with greater efficiency, use of cheaper alternative drugs, and we do look at those that data to highlight any practices which may have a different prescribing pattern. So we do everything we can basically to try and influence and control that position, but there are some factors which are outside of our control. So quick comment from me, and Kate I'm sure can give some further detail. So thank you, Kate.
Thank you, Pete, and thank you, Carl, and thanks for the question. So yeah, there's a lot of work going on here. So our medicines management team have been for some time working really closely with our primary care colleagues. We measure quite a lot of metrics in terms of prescribing practice. It's not only, obviously it's financially important, but a lot of it's about quality as well. So that's really, really important. And actually, we've got a really strong dialogue with our, so we gather information about key prescribing indicators, and we regularly feed back to primary care. So it's sort of a learning loop, and that's proving really effective. Primary care really like to hear back from us about what's happening and good practice and where we can improve. And we are seeing improvements in some areas. I think we've talked about the cost pressures, which are very challenging, and we've also got other contexts, such as some areas are difficult because we've got people waiting long for treatment. Then prescribing for pain relief, for example, is challenging, but it doesn't mean we can't improve. So we're doing a lot of work locally, and that continues, but we're also learning. Our chief pharmacist is obviously part of the national conversation, and there's a lot we can learn from sort of neighbouring health boards and from what other health boards are doing. So we're continually in the conversation, seeing how we can improve. There are also, you know, I think nationally we may be learning there may be more efficient ways of delivering services as well. So I think that's a sort of active conversation as well. So I think there are many, it is important. There are some opportunities to save money and improve quality, and we are learning as we go.
Thank you. Kirsty, do you want to come back in, or okay?
Yeah, thank you. That's
Okay.
very reassuring to hear about the broad nature of that work, both locally and nationally. Thank you.
Jen, please.
Yeah, Jill, thank you. Pete, I just want to sort of say, you know, well done. You know, from the updates you've been giving us, I can see that the number of, I'm talking about progress against savings targets, sorry, I should preface it when I'm saying, so the progress against savings targets, the number of those amber going into green, that seems to be going, obviously going in the right direction. That's really good to see. I'm just looking at those reds as well, and I was wondering, how stubborn are those reds, and what is it going to take to shift those reds? Are you confident that we can shift those reds into the amber zone, and then hopefully amber to green? And maybe that's linked to what Kate has just been saying, because I know that a lot of those red schemes are in primary community care, etc. So just a comment on that, I'd be grateful. Thank you.
Okay, thanks, Jen. So first of all, I think that comment about well done, that's not me, that's the organisation, that's every department, that's everyone responsible for looking at schemes, identifying ideas, and it's very much a team effort. So it's all budget holders, finance support, other support. So but that thanks should go to the organisation, not to myself. So just to make that point, I think just a reminder really that we've been promoting a sort of a continuous pipeline of ideas. So I'd always expect a number of ideas to be in the red scheme, and as we work through those, some of those may be not deliverable, considered okay, we'll take them off the list. Others will continue to be looked at to hopefully bring forward into that pipeline of opportunity. So we do have the required number of amber and green schemes to meet our target, the 7.5 million. The red schemes are on top of that, so would further help to improve, or could further help to improve as we move into the next financial year. So it's a pipeline, and I would expect to have red, and we're focusing on those pipeline to either take forward or to discount. So it's that sort of approach. Okay. And Carl, could I make one other comment that I just to, it's included in Appendix 3 of the papers. It's just really a point to make that given that we've got a deficit plan, clearly that means we'll be spending more than the income that we're allocated. So as a result of that, we will require revenue working capital cash from Welsh Government in the latter part of the year that will cover that deficit and will provide us with the actual physical cash to continue to make the payments and commitments that we have. So it's important that I flag that point within this part of the report.
And that is agreed, is it, Pete? Forgive my ignorance, but in terms of the availability of that cash flow, as it were, that's that there are no barriers to that.
So it's no, not at this stage. It is something that we report regularly through our monitoring in terms of Welsh Government. It's an identified requirement, and they will be working on that planning assumption to do that, and we review it month on month.
Thank you. Hayley, please.
Yeah, thank you. I think the report and the progress around the savings target is a credit to the organisation. I do agree. I guess the difficult situation here is the scale of our deficit that we're holding now as an organisation, and the scale of service changes that we would have to put in place to bring us fully back into balance. So the reason I mentioned that is that the work that's being done currently to look at what is the sustainable model for health and care going forward is part of the conversation that we will have to have as part of our deliberations going into the planning round for 24 onwards, because the expectation around how we bring this organisation back into financial balance will be the key focus of our discussion in those enhanced monitoring meetings with Welsh Government. So I think it's remarkable the work that the staff teams are doing around the savings targets currently, and I'm very pleased with the progress, but there will be a strategic challenge for us as a board to actually look at what that longer term future model will and should look like in light of the current scale of the deficit that we're dealing with. And I think that that will feature in our public meetings as we go forward and get nearer to agreeing our submission, revised submission to Welsh Government going into 24 onwards.
Thank you, Hayley. I can't see anyone else wanting to come at this stage. So just a comment from me, really, in addition to Hayley's comments, that acknowledge the very assuring response and work that's been done across the organisation, but also to say that we're not alone, are we? And this is affecting all health boards in Wales, and indeed the whole health and care system across the UK. And actually, when you look at how other organisations are looking to meet these challenges, our performance, relatively and comparatively, is very good. And so that shouldn't make us complacent, and it doesn't make us complacent. But within the scale of things and within that context, the organisation is certainly heading in a good direction. But thank you for that, and for that, for those comments about confidence in relation to deliverability, which of course is an area of focus that we've had in our previous discussions. So I can't see anyone that wants to add to this conversation or discussion at this point. So we'll go to the recommendation. We've discussed and noted the month 5 financial position. We've discussed and noted the financial forecast deficit position. And so I'm assuming that everyone supports that recommendation. Thank you. So I think we've deserved a comfort break. So we'll move to our break now, and we'll reconvene at the scheduled time of 11:15. So diolch yn fawr i chi am eich cyfraniadau, ac mi newn ni ailgychwyn y cyfarfod am 11:15. Diolch yn fawr. Okay, I think most of us, if perhaps all of us, are back. Are we okay to go, Liz? Croeso nôl, hyfryd eich gweld chi unwaith eto, ac mi newn ni ail-gychwyn y cyfarfod trwy symud i eitem 3.3 ar yr agenda. We turn our attention now to item 3.3 on our agenda, the closure of the branch practice at Gilwern. Just a reminder that this was a substantial item for discussion a couple of meetings ago. The decision was taken to support the recommendation as regards the closure of the branch practice, and so however, it was decided to keep monitoring the mitigations plan in relation to that decision, and therefore it remains on our agenda for today. So we're here to look at the implementation of that mitigations plan. So Pete and Adrian are with us. Are we coming to you first, Pete, or going straight to Adrian?
Yes, thank you, Carl. I will present the paper, and Adrian has joined us to help pick up on any comments on queries, given his role in the development. So, as you said, this is a standing item on our agenda for the board. The full detailed report is included in the papers, and the full mitigation plan is as detailed and attached as an appendice. I just wanted to highlight a couple of key things, and then we can move to questions. So the task and finish group is now meeting on a regular basis. A reminder to the board that that is a multi-organisational setup. We've got representatives from CLICE and from local authority, and obviously both health board partners. And really just wanted to flag a couple of the sort of key highlights or key points as part of action that's been taken. So continue to have those regular meetings with the local community transport providers, working through what the potential impact will be on residents and how that can help to meet their needs and demands. Keep focus on any changes to the practice registration, looking for any changes in the list size and any movement that we see, and we continue to monitor that as we go forward. The planning is underway in relation to the community development and participation event. Obviously, that will be key to helping to engage with the community and look at how we can strengthen the health and care provision in that area. And a letter is going to be sent to all households for all registered patients from the Crickell practice. So those are really the key things to pick up on. I will say that there has been a lot of work in this area. You will see from the mitigation plan that there are a number of closed items. You can see the detail included in there in terms of the action being taken, the progress being made, and it's a full and inclusive piece of work. So I'll pause there, Carl, and then happy to take any comments. And as you said, Adrian is with us to help pick up on any points of clarity or detail.
Thank you, Pete. Any additional comment from you, Adrian, before I invite others to come in?
Thank you, Chair. And yeah, just to stress that the patient letter, we've agreed that will go to the households within the Gwent area of the Crickhowell Group practice, as those are the ones most directly affected by the closure proposal. And also just one further update since we concluded this report as well, is that we've now been able to confirm the date for a community participation event that will take place on the 2nd of November in Gilwen Community Centre. So that's an opportunity to meet with the community, representatives there from Anara Bevan Health Board, from the local county council, from GAVO, the Gwent Association of Voluntary Organisations, and their representatives, to be able to share information about the wider range of community health and wellbeing options and listen to the community about opportunities for further development in that area as well. So all of that information now being shared with stakeholders in order to continue to take forward the action to deliver the mitigation plan.
Thank you, Adrian. So this is here for our consideration as a source of assurance that the mitigation plan is being implemented comprehensively and effectively. Does anyone want to ask a question or come in at this stage? Katie, please. Yeah.
Thank you, Chair. Thank you, Chair. And just to reiterate my declaration at the beginning of this meeting, I am a patient of the Crick-Howell practice. Yeah, so as Pete says, we've joined the Task and Finish group, which is really helpful and really interesting and really valuable. I think for us, there's obviously an incredible amount of work that has gone on, is going on, but for Llais, it's about where the devil is in the detail, really. So yes, to have a car scheme is fantastic, to send a letter is great, but does the car scheme fit with patient appointment? So if you get an appointment at 11:30, can you get a car at 11:30? So it's the detail, I think, really, that we're continue to, as is our role, to challenge on, really, not just the sort of putting the things in place, about the practicalities and the impact on patients. So just to add that to this presentation.
Thank you, Katie, and the good thing is that you're and involved in those conversations, and your questions and comments will be helpful to shape things as they're taken forward. So thank you. I can't see anyone else wanting to contribute, and so thank you for the report. We're asked to receive and note it and approve it as a source of assurance in relation to the progress being made as regards the mitigation plan. Of course, we're also asked to note the correspondence with Llais that is also provided for our information as appendices to the report. Please indicate if you don't support that recommendation. Thank you. That's supported unanimously. So we turn to item 3.4 to our Director of Public Health, Mererid, and to the report on the winter respiratory vaccination programme. Diolch, Mererid.
Yeah, diolch, Cadeirydd. So in terms of the paper, our winter respiratory vaccination programme, which includes both COVID and flu vaccination, commenced early September, with a focus this year on protecting the most vulnerable and supporting the resilience of our health and care systems. So our plans, which are detailed in the paper, are guided by the JCVI, which is the Joint Committee on Vaccination and Immunisation, and Welsh Government, who set out the eligible groups for vaccinations. So we adopt a blended delivery model, and this includes vaccination centres at Bronllis and Newtown. GP practices, pharmacists participate, school nursing teams, mobile teams, and many health professional teams such as midwives, district nurses, and occupational health team. So the delivery model this autumn has increased availability of clinics in communities across Powys to improve accessibility, with the aim to increase uptake in eligible groups with ambitious targets set. And colleagues in Public Health Wales are leading on delivering a public communications campaign to promote uptake of vaccinations. So earlier in the board meeting, I mentioned that it's likely to be a challenging autumn and winter, and respiratory infections, as we know, can spread easily between people. So a key message is really to take up our vaccination when offered, and an action that we can all take to protect ourselves, our families and friends, and particularly those who are vulnerable in our communities. So the deployment plan will continue to be monitored and agile to deliver the respiratory programme during the autumn-winter period. So I'm happy to take any detailed questions on the report. Thank you. Diolch.
Does anyone want to contribute, ask a question, or make a comment? Ronnie, please.
Thank you, Carl. Mez, can I just ask about the position in relation to staff groups, both for COVID vaccination and for flu vaccination? Where are they in the actual scheduling of the programme? Thank you.
Okay, yeah, so thank you. In terms of COVID and flu for health staff and usually social care staff as well who are eligible, invitations have been sent, and those scheduled appointments are week of the 11th of October. Equally, if individuals are eligible because they're in an at-risk group, which they may be called earlier through their GP practice as well. There'll be flexibility within that programme as well. If they're unable to attend any appointments, they can contact the booking centres to be rearranged. And then following the opportunity to be vaccinated at the main centres, we will be organising clinics across the health board as well.
Thank you, that's helpful.
Thanks, Mares. Just whilst others are perhaps considering the report, a couple of things. I was thinking that somebody may read this report from Powys and look at that blended method and think, well, I can see that some GP practices are participating, but not all. Why isn't my GP practice participating? You know, what determines that?
Okay, thank you. Yeah, and colleague Kate Moment to come in as well. So in terms of GP practice, all practices deliver the flu vaccine, and they have done for a number of years. In terms of COVID vaccine, that obviously is a new additional vaccine to the programme. And in terms of the participation, there's a number of elements. There's a window for participation regarding vaccinating of our most vulnerable in September. And co-administration of flu and vaccine will depend on when vaccines arrive in practices as well. And also it relates to capacity within practices to be able to deliver. So where practices are not participating for COVID vaccine, we have offered our older cohorts access to vaccine in the local community, and that is detailed in the invitation letters. If individuals are unable to attend the vaccine appointment, we encourage people to contact the booking centre, who will be able to offer alternative appointments.
Thank you. And just some comments you might like to make on your level of confidence in terms of deliverability. So there are the objectives, aren't there? Are you yeah, how confident are you that we'll be where we need to be at the right points?
Okay, yeah, thank you. So in terms of the flu programme, that is a well-established programme in terms of delivery, and colleagues both in GP practice, I should also say pharmacy as well, deliver that programme. And the COVID programme is a blended delivery model, and there are good logistics and staffing models in place. We will continue to monitor the uptake and respond accordingly, and any additional directions that may come from Welsh Government as well. So, yeah.
So is that confident, or I wasn't quite sure whether...
Yeah. In terms of the delivery model, we are confident. Yeah.
Okay. Thank you. And Katie, I think is that a second one? Yes, please.
Yes, just very quickly. Adrian and Steve have kept us in the loop with these developments, and I think it's really reassuring that in this year we've got the outstations in Llanfyllin, which was always one of the ones that was quite a long distance to get the vaccinations, and also Ystrad. So even though not every practice is participating, I think from the point of view of a geographic spread, it was really reassuring to see that. So thank you.
That's helpful. Thank you, Katie. Okay, well, I can't see anyone that's wanting to contribute. So, as regards this report, we're asked to note that the eligible groups for flu and COVID vaccinations, and to note the blended model that we as a health board are adopting and implementing as regards the implementation of the programme. So again, that's the recommendation, and no one's indicating that they don't support it, so we support that unanimously once again. Thank you. We turn to our corporate risk register. Helen would normally guide us through this, so I'm going to turn to Hayley for any additional comments. I think it's probably helpful just to draw attention to a key phrase within one of the recommendations, that we recognise that a broader review of the organisation's risks is currently underway. So although there aren't many changes to the documents for our consideration today, we do acknowledge that this is an ever-changing world and a rather uncertain time and challenging time for us as an organisation and for the NHS, and that clearly has implications for our risk register, and that piece of work is underway and will be presented at a future board meeting. But yeah, I just thought it was worth drawing attention to that key point. But Hayley, any additional comments?
No, that's really helpful, Chair. I think that point is one of the key points I had to cover. Sorry. Because I think it's really important that people are aware that the external environment is changing. It's a very dynamic situation currently, and therefore we will be doing this work during October, so that we can bring back to the November board meeting a revised, updated corporate risk register. Just wanted to give you some reassurance. The way in which we're managing risks within the organisation is still fully up and running in terms of the directorate risk approach and how that escalates up to the corporate risk approach. But it's really that external environment and that testing of the changing situation that we want to take a little bit of time and reflection as a board and with the organisation prior to bringing back the new formatted corporate risk register in November. I would mention two things, that there are a couple of risks you'll see in the report that we are currently dealing with in committee, and that's around the cybersecurity risk and also our planning around managing the impact of a national power outage. As that work progresses, we will report when we can in the public domain the progress on those items as appropriate. And also just an emerging risk that came really through our organisation around the construction market at the moment, the impact on costs around capital projects and programmes that we're leading in Powys. That has been escalated to us through the discussions internally. And in the revised risk register, we'll be making sure that that comes back with further detail around how and to what extent, to be frank, that we can mitigate that risk as an organisation in light of the changing climate for the construction market. So what that really means is doing this sort of work in rural parts of Wales is always, there's a bit of a location factor which causes a little bit of additional cost. But when we've been tendering costs recently, that cost is much higher than we've ever experienced before. And I think that's something that the broader public service is finding. And I was in discussions with the local authority recently, they're feeling the same, finding the same with the costs that are coming through for capital schemes. So we'll pick that up in the November reset corporate risk register that comes back as well. So I wasn't going to draw anything further out, Carl. Thank you.
Thank you. Again, I'll pause. Does anyone want to make a contribution or comment, question as regards the corporate risk register? No. So thank you for the report. As the report acknowledges, there aren't any substantial changes, but it is there for our approval and our consideration. So the recommendation is that we receive this version of the corporate risk register, that we assure ourselves that it's complete and a true reflection of our current high-level risks. We acknowledge the piece of work that's going on to review the risk register, and we also note that there are no proposed amendments set for us to consider today as regards the register. We note the emerging risks in relation to costs associated with the capital and estate development that Hayley has just highlighted, and also the point again that Hayley has highlighted as regards corporate risk 009, cybersecurity, and 012, national power outage, which we look at in a bit more detail when we meet in committee later today. So those are the recommendations. Please indicate if you don't support or if you'd like to add further comment. No, so I'm assuming that all then support those recommendations and they are supported unanimously. Item 3.6 on our agenda, the assurance reports from our partnership arrangements. And so we go firstly to sorry, I'm just looking at the reports. So is this this is first to you, Hayley, for the yeah, over to you. Thank you.
Yeah, I'd like just to say that take the reports as read. Not all of the partnership boards have met since the last meeting, but just to draw out that the paper covers the NHS Wales Shared Services Partnership Committee, meeting of the Powys Regional Partnership Board as well, and Welsh Health Specialised Committee and Emergency Ambulance Services Committee. These papers were sort of written sort of prior to a couple of meetings being discussions taking place, but just wanted to highlight two things really. The first one is in terms of the Regional Partnership Board, we've just heard about from Mez about the progress that we're making around our respiratory and vaccination programme, etc. The Regional Partnership Board are very firmly in the winter system resilience planning space now and are expecting at the next meeting an update more broadly about the actions regarding winter, and that will come through the board at the appropriate juncture, Chair. And then finally, just to say that again, in terms of the very comprehensive report that you've got around specialised services and ambulance services, just to say that the engagement process around the the engagement process, apologies, around the EMITS Cymru service review is currently in operation to start in October. So again, just wanted to highlight that to the board. Thank you.
Thank you very much. Katie, would you like to make an observation?
Sorry, no, thank you, Chair. Sorry.
Oh, sorry, I misunderstood. Okay, thank you, Hayley. Robert, please.
Yeah, thank you. I just wanted to make a comment on the report from WAST. I know that we're going to do a deep dive of this in one of our subcommittees, but as many of you will know, in general, as far as red responses, Powys is either at the bottom or one up from the bottom, and this has been the case for substantial period of time. Reading the report, there are the comments that we expect an improvement because of this and that. There's also a comment somewhere, I can't find it now, but I read it earlier, that they're looking at what happens to ambulances once they've taken patients to hospital, you know, whether they're then, presumably they're looking at whether or not they're then diverted to sort of local activity or whether they are able to return to base and so on. I suppose my anxiety really is that when we receive those reports, it's quite difficult for us to see what the impact of these developments and changes are to us for our population. You know, what does it mean that they're doing? They're looking at various things. What does it mean for us? What does it mean for our patients when we continue to be at the bottom of the pile with One Trust for Wales? So just wondered, Hayley, if you could just reassure us about the, you know, the degree to which we are holding them to account, really, because I think we've been quite patient on where we are really in the red responses in particular. Thank you.
Thank you, Robert. A really important question, and it sort of mirrors the questions that I raised. You know, we have had a very stubborn problem in terms of being able to raise the performance, particularly for red, but also more generally around access in Powys, and as you say, our performance hasn't met the target all year, and there's been a pattern for a number of years that has been an issue for us. I would suggest that these reports that come through are generic reports through to every board, so every board across Wales receives the same report, and that's why I think that action that we've agreed to have a deep dive around ambulance performance for the Powys population, and that cut of information to really explore the detail for Powys in committee will be an important one. We also have planned time to meet again with EASC and the Chief Ambulance Commissioner as a board. That comes through annually as part of our board development arrangements as well. So I recognise, Robert, this report is more of a generic All Wales report, and the need for us to do further work and giving you further assurance in those discussions about the detailed conversations that we're having, particularly around access in Powys, and feel, Carl, that we probably need to bring back as part of our reporting to the board the outcome of that deep dive to see whether committee members can take further assurance then from the detailed review and assessment of actions that we're taking alongside WAST as part of EASC to deliver improved access to services for our population. But I share your concern, Robert, that unfortunately we haven't been able to translate this into improved performance yet for our population.
Thank you, Hayley. Really, really important point. Robert, is that okay? Do you want to add to that in any way?
No, thank you for that response, Chair.
Yeah, but I think, Hayley, it is very important, and I think your suggestion of the board's sightedness on that deep dive and its and the outcome of it would be really helpful. Thank you. Jen, please.
Diolch, thank you. Hayley, I just wanted to ask about the Mid Wales Joint Committee for Health and Social Care, MWJC, and I note that in the paper you said that it hasn't met since the last board meeting, and there's meeting again on the 14th of November. So I suppose when I read that, I was a bit frustrated, and I just want you to assure me, ought I to be frustrated, given the absolute alignment we need between health and social healthcare and social care, etc. How can I put this politely? I'm just keen that there's urgency, that those issues are being discussed, and there's momentum behind trying to resolve the very real issues that are out there in terms of joining up healthcare and social care, etc. Yeah, it's just, can you reassure me that there's enough energy going on in that space, and the role of the Mid Wales Joint Committee what's its role in that space, given that we've got so many partnership boards? I'm finding it, to be honest, quite confusing how each one relates to one another, but I'm not going to go there. We can pick that up again. But what's the momentum in that space? And in terms of the Rural Health and Care Wales Conference, what's the aim of that conference? What's the actions? I know that's not necessarily your bag, but I'm sure you'll be keen to get deliberate actions coming out of that work so we can shift the dial on this. Sorry, you're probably picking up a frustration. Please tell me there's no need to be frustrated.
Yeah, thank you. So obviously the Mid Wales Joint Committee has a long history and came out from the original work that Marcus Longley's report had done, which was about making sure that there was strengthened planning and relationships across the Mid Wales region. So we're talking about working across the whole of our Health Board region, Betsy as ourselves alongside WAST, and also that important relationship with social care. The committee hasn't met, but I just wanted to give you some reassurance, and perhaps I'll ask Kate and Steve to comment. The full committee hasn't met, but there have been several meetings that have taken place. Kate chairs the clinical leadership group, Jen, and Steve has been representing us in the executive group as well. That has been meeting to take forward key pieces of work. So I would like to think that when you come to if you listen to the Mid Wales Joint Committee next meeting, you'll be able to see the progress around those key areas of work that they've been leading on. So and I think that from my perspective, Powys, we've taken, I know that Carol was lead chief executive for a year, as well as I was lead director of planning for a couple of years ago, and we have done a lot to take forward this committee from a Powys perspective, and you know, we'll continue to work alongside. It was born out of the need to recognise the strategic importance of Bronglais General Hospital in Aberystwyth and the need to make sure that there's a sustainable model of care there, and we've done that. We've worked alongside them over the years to make sure that we do all we can to support. Clearly, I wonder whether Kate or Steve would like to just give a bit of reassurance about the meetings that they've held, so that you'll give you a bit of a flavour of what will come through to the Joint Committee at its next meeting. Thanks.
So, Steve, should we go to you first? Thank you.
Okay, yeah, thank you. Yeah, thanks, Jennifer. So, absolutely, as Hayley said, some of the other subcommittee meetings that they have occurred and do occur, and we are looking to develop services in that joint space. So, share posts, try to future-proof service delivery across Mid Wales. Notwithstanding, obviously, some of the capacity challenges that we talked about earlier in the meeting, but it's a very active subcommittee that the meeting I attend. And then just generally, in terms of that daily operational interface, Jen, just to reassure you that that happens all the time with operational colleagues in the Health Board and within Powys County Council to maintain that sort of flow and that system cohesion. And then twice a week, we meet as a more of a senior team, myself, Kate, Joy on the call with our counterparts, Nina and so on and so forth from the council, to ensure that that overall oversight happens. Thank you.
And Kate, please.
Yeah, thanks. Thanks for the question, Jen. So, so I chair the clinical advisory group, the Mid Wales Clinical Advisory Group, and we meet regularly, and that's the Health Board, so Betsy Cadwallader, Haldar, and ourselves with input from South Llanway Valley. It's a really, it's one of the ones I really enjoy chairing. It's a really rich forum. We provide clinical support for and advice to some of the main strategic aims of the Mid Wales, the group. We also, it's a real opportunity for us to understand each other's challenges, which actually is really, really important. And often we can find solutions or offer mutual aid and challenges and fragility. So by understanding fragility of all of the services, then we can really help to put clinical plans in place. So there's lots of joint discussion. We have done quite a lot of pathway work, so we've chosen some key areas where maybe there were challenges or difficulty in pathways to try and work together to find sort of a joint regional pathway which might work better for our patients. So we've done some work on neurology recently. We're about to have a joint workshop. One of the things that we're conscious of is that there is a risk of health boards doing the same work, sort of duplication of work. So we're having a joint workshop very shortly to look at our 6 goals work for emergency care, to see if we can learn from each other's work, see if there are ideas that other health boards have had that we can translate, or see if we can join up. So hopefully that's a flavour of the work that we do. It's a very rich clinical conversation, but linked to the sort of the planning and strategic priorities of the Mid Wales group as well.
Thank you, Kate. I wonder, Jen, as well, if it's worth just my making an observation that I mean, the point you make about the urgency of the health and care system and cooperation, partnership, and so on, is a really important one. Of course, the Regional Partnership Board has a very important part to play there as regards PAWIS, and certainly that's a partnership that we would look to in order to take forward certainly a lot of that integrated work. And of course, the Joint Partnership Board between ourselves and the Council is an important forum as well for looking at other aspects of our joint working. So I just wanted to point out that we do have our PAWIS-based partnerships as well that look at more specific PAWIS-based partnership and collaboration, but really important point. Thank you. Do you want to come back, Jen, at all? Do you want to make any additional comment?
No, that's all very reassuring. All good.
Thank you. So that, I think, concludes our discussion as regards this item on the agenda. So in relation to the partnership arrangements and the joint committees, we're asked to receive and note the updates contained in the reports. I'll just pause to see if anyone doesn't support the recommendations, in which case we support those recommendations unanimously. We go now to item 3.7 and to the report from Llais, and again to the Regional Director, Katie. Thank you, Katie.
Diolch, Chair. I'd just like to pick up a couple of things, if that's all right. The first really has happened since I wrote the report, and it relates to the proposed change at Neville Hall and the MIU there, and the engagement exercise that's being undertaken. I think I've shared my disappointment and frustration about the communication or lack of, so we won't dwell on that. But I would too really appreciate and value the sharing of plans and the consideration of PAWIS patients in any changes moving forward over these particularly over these few months. And I've also picked that up, the need for communication around changes, picked it up with my regional colleagues in Llais as well. Communication will be key during this time. The reason that Neville Hall and this proposal is in fact extremely sensitive is not because of numbers, but it's because of the potential impact really on patients. And I think we mustn't forget that it wasn't that long ago when the A&E department at Neville Hall was closed, and there were particular sensitivities around that. And there was a commitment at the time to a 24/7 MIU at Neville Hall. So I think it's really important to recognise the strength of feeling for these communities and the perception, if nothing else, about yet another service being taken away. And I think it's also important to note that there is a petition of over 2,600 at the moment. So the communities, I think, of South Powys and of that North Gwent area are particularly focused on this particular service change. And therefore it is one that we will be keeping a very close eye on, and we welcome the extension of the engagement period. And we also welcome and are grateful to the Powys Teaching Health Board for promoting the events that are happening through social media, through their websites, and that is really positive, and that approach could be shared. So I think, yes, as I say, although the numbers are small, the impact is, could potentially be quite significant. It could potentially increase, as we all know, the number of patients that in the end attend A&E, particularly if the MIU pathway at the moment, the proposed pathway is down to Newport to the Royal Gwent. So we are keeping a very close eye on this, as I know the Health Board are, but I just wanted to make a few observations at this particular meeting. So moving on to the report, we've had an amazing couple of months. The locality approach is really proving to be, I think in the report it says You know, we've spoken to over 750 people. We did the focused approach in Welshpool, which was really, really positive. We've just completed the focused approach in Ystrad, where we spend 2 weeks in a particular geographic area, and we will be working in Builth, or listening to the communities of Builth in November. And the amount of information and feedback and rich data that we're getting back from all of those sessions, I think is going to be really, really useful. I think the issue for us as Llais in Powys, and also for the Health Board and also the local authority, is how we actually share that information and how we actually use that to, or how you choose to use it to perhaps inform the development of services and impacting on your sort of prioritization. So that little link still needs a bit of working through. We've published, I think, 7 reports since we last met. What we're looking at doing is to make them more accessible. So we're looking at using avatars and AI to simplify those reports, so they're not just words on a piece of paper, but actually we need to focus on what impact they make going forward. We've got lots of people who are interested in those reports. We obviously work with a lot of community groups, so that sharing of that data and that information is going to be critically important, but also recognising that we're very, very keen to get feedback from both the Health Board and the local authority, appreciating pressures on everybody's time before we move to publication, and all of that is in hand. I suppose my final plea is, for anybody sat around this virtual table, or for anybody who's watching, is we're really keen in Powys to be recruiting volunteers. You can see the level of engagement and outreach that we've been undertaking. That's predominantly with two staff and a few volunteers. We've divided Powys into 13 localities, as in line with the RPB and community connectors, yourselves and the local authority, and we will be looking at least 5 or 6 volunteer members in each of those communities. So if any of you know of anybody who might be interested, and if anybody is watching this later on, if you know of anybody, please do let us know. We are very keen to build and strengthen that, so that we can, the Ystrad and Welshpool approach is very intensive, and it's really important that we, if we're going to continue to adopt that approach, which I hope we will because it's very effective at the moment, we do need to strengthen that volunteer infrastructure. So that's my plea, Chair, and I'm happy to take any questions.
Thank you, Katie. Would anyone like to come in? And I just wonder whether particularly any exec colleagues would like to come in about the specific matters that Katie has made. Hayley, please. Yeah.
Yeah, thank you. Thanks, Katie, and thanks, you know, the reminder of the history around, for example, the changes around Neville Hall, etc. are important, and I do appreciate not only the sensitivity but also the strength of feeling from those communities. Just wanted to give you the assurance that we will work alongside Aneurin Bevan, yourself and others to make sure that we are engaging appropriately on those changes, and then we'll bring it back here for our view as well as a health board, as we commission from Aneurin Bevan, and we'll be having those discussions. So some assurances, we'll work closely with Aneurin Bevan on that particular point. I think the issue that Katie raised around the intelligence that she is gathering through her work and the team, and how we triangulate that information and bring it into the sort of organisation. I wondered whether Claire would like to come in and comment, because I think it's really important that we look at all of the various sources of information, and that you also get that feedback loop in place as well with Llais. So Claire, would you like to come in on that? Thanks.
Yeah, thank you, Hayley, and thank you, Katie. And I think that point is really important in terms of how we triangulate all of the intelligence and data that we collectively get, both directly through the organisation in the health board, but equally being able to sense check that with the intelligence that you're receiving through Thlice, Katie. And one of the things that we are going to try and really scale up within the organisation is to be able to do sort of snap surveys really with people who have been using our commission services, particularly like building on Civica as a tool to be able to capture patient experience and feedback. So I think there is a little bit of a shift really in terms of receiving the feedback, whether that is through, you know, concerns, complaints, etc., but actually actively trying to reach out to people who've used services in across multiple pathways to be able to actively seek their feedback. And we now have got Civica. We just need to be able to use that tool and build up our capability and capacity in using that tool. So as ever, Katie, I'm very happy to have a conversation offline. I appreciate that you know, the move to Thlice has probably dominated you in terms of your time, but you know, maybe that now is a really good opportunity for us to touch base outside of the board meeting, and I really welcome that. Thank you.
Thank you. Anyone else like to comment? No. Katie, do you want to add anything in response to what you've heard?
No, thank you, Chair. I mean, the relationship between Thlice and Powys Teaching Health Board, I think, is a very strong one, and we're happy to have difficult conversations professionally and to work our way through things. So I don't have any concerns. It's just some of the operational and capacity issues that we just need to bottom out. But I am very excited about this sort of different approach, and I think it will provide some very valuable data and information from communities about a range of services rather than just a specific service. So we'll continue to work together on it. So thank you, Chair.
Thank you, Katie. You raised some really important points. I think, you know, as I was just listening to the discussions and reading the papers, you know, that we need to help to make sense of the information that comes our way. And as Claire says, we have a lot of information from different sources. And Thlice is a very key, important source. And sometimes that information seems to be different, shall we say, in terms of and you know, and as a board, we need to be able to make sense of that difference. So I think it's a really, really important point. So thank you for that. So we receive the Thlice report with gratitude. We turn our attention to item 4.4 on the agenda and the board work programme. I don't think I have any particular additional comments to make there. Of course, Helen isn't with us. There is just one slight thing that might just help to there is a question mark in relation to the Llandrindod Hospital Phase 2 item and where that might appear on our board work programme. I don't know whether Hayley, you or yeah, please do.
Happy to come in on this. So the business justification case was due to come back. I mentioned earlier under the corporate risk element the costs that the spiralling costs of tendered costs around construction and capital projects. That issue is live currently for the Llandrindod business justification case. So we're doing further rapid work to review the position so that we're in a position to be able to bring that back to board as soon as possible. Unfortunately, we haven't got a date on that yet because the meetings are actively taking place during this week. As soon as we're in a position to confirm, I will make sure that that's timetabled back in for board consideration.
Thank you. Does anyone have any comment or question as regards the board work programme? No, okay, well, thank you. It's there for information and for consideration. I'm not aware of any other business that anyone has, and therefore I assume that there isn't any, which means that that concludes our business for today. The next meeting of our board will happen, can somebody remind me of the date?
29th of November.
29th of November. Thank you, Hayley. But for today, it just remains for me to thank everyone for their contributions to this meeting. Thank everyone particularly for the huge amount of work, impressive work that goes on. That is the discussions we have point to and are evidence of, but that is noticed and appreciated. But for now, thank you very much, and I will see board colleagues in a few minutes at 12:15 when we meet for our in-committee meeting. So diolch yn fawr i chi, diolch am bopeth, ac tan y tro nesa. Hwyl fawr.